I'd just like to say thank you for everyone for coming to this event. I know a lot of our partners have had to travel a significant distance, so thank you very much. So this morning, we've got a little bit of a presentation plan, but just to start us off, I'd like to introduce Mike Barrett, who's our LHIN CEO, just to say a few words, and then Dr. Sharp is going to do a bit of a recap on where we are and where we're headed, and then I'm going to do a bit of an overview about the moderate research planning here in the Southwest LHIN. So welcome, Mike.
Thanks very much, Carrie, and it's nice to see a number of familiar faces around the room. And sorry I didn't get around; I just got here a couple minutes before 1 o'clock, so I will stop and say hello to some of you that I know. So again, I'll echo what Carrie said. Thank you very much for coming. I know how busy you are in your own hospitals, busy in your own communities, but to take the time to allow you to travel and to look at one of the what we need to do a principal healthcare system is very important. Our partners obviously together, how do our hospitals work together, how do we build care homes, how do we care access centers, how do we all work together in one fight system. First of all, I'd just like to commend you as well for the work that you've done on minor surge. I think you've made great progress in the process unfolded back in 2008. Looking at human resources, equipment, physical space, how you're going to function when you get to that point of being up to 15% over capacity. But I think probably for me the more important thing there is that not only is the planning been good, but the planning builds the foundation for the next step in this process about how you work together across your respective critical care units within hospitals. And hopefully that will be I think we are in a better position, and we'll continue to get into a better position in managing should a pandemic or something similar come where we're going to have incredible pressures put onto our ICUs. One project which I'm not sure if you've heard about this morning is the Patient Access and Flow Project, and this is a project that the genesis of it was back probably about 18 months ago. The 19 hospitals in the Southwest CEOs come together bi-monthly group together about how they PCS together. Well, we in that group, there was discussion in that table was, well, we can't get beds in London. Community hospitals, we can't get access to beds in London. The London hospitals, well, we can't repatriate patients back to the community hospitals. And I think this discussion has been going on for a long time. The Patient Access and Flow initiative hopefully is going to make some improvements to some of those concerns that have been raised over the past, for several years, I guess. We've been very fortunate to have Steve Elson and Catherine Lover working on the Patient Access and Flow project. They made significant strides, and I know there's some significant dates coming up starting next Tuesday, and then I think there's some issues around templates the next week, so maybe a 2-week delay before all the templates are in place. But it's making progress in terms of how the system works together. So again, demonstrating, as opposed to all of us looking at our individual organizations and individual sectors, how we interrelate with our partners across the system is so important to us. Although this relationship between all of you here, Carrie, room as well, and taking those steps and other steps that will be taking a while in terms of how we function as a system. You're going to hear from Mike about the LHIN policy that he's proposing, the Intensivist on Care pilot project, which again I know is happening in the PED sector, makes all kinds of sense in the adult sector as well. So it's a lot more complicated, bigger volumes in business, but I think it can work, and Mike is going to talk to that today. Just coincidentally, Mike was at our Southwest LHIN board meeting yesterday. He gave an overview of a lot of the things that you're going to hear about today from him and Carrie. And our board, again, was very pleased with the work that's been going on. When he hears about how organizations have been working together across the system, I think they're very pleased and hopefully fulfilling our mandate at LHIN in terms of bringing health service providers together. Last point before I turn it back over to Carrie is I just want to recognize Carrie. We've been very fortunate with the recruiter. She came all this from Australia. She's working there as a consulting firm. So we're very fortunate, but she's going to have her here. Not only doing the training care file, but also the emergency department file with our emergency department lead doctor, Lisa Shepard. And for most of you, you've probably heard we've got lots of pressures in the emergency departments as well, including places like Southampton and St. Mary's, some of our small rural hospitals. And I think, again, there's a function to play in terms of how the organizations work together. And there's great work going on there as well. So, again, thank you very much for coming today. And I'll turn it back over to Carrie and to Dr. Sharp.